So how do you know if you should see a doctor about back pain? If you look at studies about back pain and its incidence, probably about 95% of adults will have at least one episode of back pain lasting up to 6 weeks within their lifetime. So it's something that's very common. But the good thing is that most people do not need to seek medical attention from a physician, and in particular a surgeon, for back pain. Most back pain is what we call mechanical. This means that it's related to the muscles that help to support and move the spine, and it is not related to either structural or neurological instability. For most back pain, it can be treated conservatively, meaning non-operatively, with gentle movement, physical therapy, exercise, in some cases, judicious amounts of acetaminophen or ibuprofen to help with pain relief. Generally, this is going to treat most cases of back pain. However, in those cases where you have failed conservative therapy, meaning you've done all of the things that I just talked about for an extended period of time, and you still have back pain, and it is associated with one of the following: motor weakness in the lower extremities, below the waist. So you have weakness in a specific muscle group that can be traced back to a specific nerve root. That's a problem. If you have numbness in the distribution of a specific nerve root, in other words, it can be localized to a particular area, that's a problem. If you have saddle anesthesia, meaning numbness in and around your groin, so in your private area in the front or around your anus in the back, if you have a significant and sudden change to your bowel or bladder function, your ability to control those things, so if you have any of those things, that is a sign that you need to speak to a physician, and in particular a surgeon who does spinal surgery, to be assessed for whether you need to have something done about your problem. But generally speaking, other than that, you don't need to speak to a surgeon or a physician about your back pain. Hope that helps.